Welcome to this short lecture on acute inflammation. In this lecture we will cover what is inflammation, what's the purpose of inflammation, what causes inflammation, what are the clinical features of inflammation, what's the process of inflammation, and finally what's the outcome of inflammation. So for this video on acute inflammation, we're going to essentially cover these 6 points. What is it? What's its purpose? What's its cause? The clinical features, both locally and systemically. The process, which is essentially the pathophysiology, and then finally, what are the outcomes? So starting off with what it is. So inflammation or acute inflammation, the name acute suggests it's probably got a short time frame, so it comes on rapidly and then it disappears. Not to be confused with chronic inflammation, which we'll cover at another date. So the inflammation itself is a non-specific part of the immune system. So with the immune system we have the innate and the adaptive. So we're focusing on the innate. So it's always there and it will react always the same regardless of what's causing the injury. So like the anatomy part of your innate immune system, which is like your skin or your mucous membranes or your tears or your wax, the inflammation is a physiological reaction of the innate immune system. So it is a process. It reacts regardless if it's a bacteria, regardless if it's a ischemic injury or a physical injury. It will just happen the same way. It has to happen in vascular tissue. So it will only occur within vascular parts of your body that have a blood supply. And it's important to note that it's non-specific. So always will happen the same way. What's the purpose of it? So this is the second point. Well, it will neutralize the injurious agent. So whatever's causing the inflammation, it will neutralize it, hopefully remove it. It may seal it off from the rest of the body. So if this was in your hand and it was from an infectious particle, it will seal it off and stop it spreading elsewhere to the body. So that's a good thing to do. And then finally, it helps with the repair. So it's very important at starting off the wound healing process. The causes. Well, the causes are quite varied. There's quite a long list. A common one is microbes. So these are infectious organisms that come into your body, invade your body, and they will cause damage to your body. So it's important that we have an inflammatory response to this. So these could be bacteria, viruses, fungi. The reaction's the same. So these infectious particles will come in, they will have antigens with or on them, and that will cause a process or the inflammation process to start. Physical trauma can cause inflammation, such as trauma like being hit or punched or something like that. Radiation, so like UV light, can cause inflammation. Burn, so temperature, whether too hot or too cold, will be a cause of inflammation. Chemicals, so this would be like pH, acids or bases, can cause inflammation. Ischemia, so that's a good example. That's a good one. So this is a reduction in blood flow and then therefore a reduction in oxygen. So for instance, a myocardial infarction or a heart attack, that will cause inflammation to the heart. Foreign substances, so this could be things like, let's say, a splinter. You get a piece of wood that gets stuck in your skin or in your wound, that will continue to cause inflammation because there are things on it that your body's reacting to. Or maybe if there's like suturing from a closure of a wound, there could be certain material in that suture that would cause reactions and ongoing reactions, thus inflammation. And then finally, your immune system. So sometimes your immune system overreacts, and this is what we call hypersensitive disorders or reactions. So a good example of that is the type 1 hypersensitivity disorders, like you react to pollen or peanuts. These aren't really damaging substances, but for some reason, for some individuals, their immune system overreacts, releases too much histamine, and that causes the inflammation. So there are some examples of causes that will cause inflammation to occur. Moving on to clinical features. This one is really important, and not only is it important to know what these features are, but when we go through the process itself, it's good to know the mechanisms that leads to it. So the clinical features are categorized into two. You have your local and you have your systemic. The local are the classic features that you hear about when you study inflammation, being the classical 4 signs of inflammation. Sometimes they're in Latin, so sometimes they're called rubor, calor, tumor, dallor. If it's not Latin, it would be redness, heat, swelling, pain. And then the 5th one is loss of function. So this is usually always localized. So if it was in your hand, you had an inflammation, you would have redness, heat, swelling, pain, loss of function in your hand. Whereas the systemic effects, this is whole body. So some good examples, and these are the ones you should know. Fever, you have an acute plasma protein release from the liver. Leukocytosis, so an increase in white blood cells in your blood. Your heart rate will go up, your blood pressure will go up, your respiratory rate will go up, and even things like anorexia, which is lack of wanting to eat, or maybe malaise, you just feel run down or just tired, lethargic. So they're the clinical features. We'll go through and explain what causes those. Before we jump into the process, it's also important to note within the medical terminology, you would hear the suffix called itis. Itis means inflammation. So whenever you hear a body structure with itis, it refers to that structure being inflamed. Such as, if you have inflammation of your colon, colitis. If you have inflammation of your appendix, appendicitis. If you have an upper respiratory tract infection, that would be bronchitis or laryngitis. If you have inflammation of your joints, that would be arthritis. If you have inflammation of your skin, that would be dermatitis. So that's important to know when you're looking at the medical terminology. Itis always means inflammation. So let's go now to the process. This is the crux of this lecture. How does it happen? What causes it to do this? So before we get into this image, the first thing you need to be aware of with acute inflammation, there's 2 stages or 2 main steps. There is the vascular, which refers to the blood vessel, and then there's cellular, which refers to the cells. Usually inflammation will go into 3 steps. They're the 2 categories, but the 3 steps being vasodilation, so blood vessel gets bigger, permeability becomes more leaky, and then cellular or white blood cells go in and remove the injury or the cause. So let's go through the process now. Before we start, just so you know what this image is, this top layer is your epidermis, this is the hypodermis or dermis, and this is your blood vessels. So this is where we're going to do our particular inflammatory process today. So I'll get rid of the title, and what I'm going to do is I'm going to cause an injury to the skin. So let's say you stood on a thorn. So the thorn came through and punctured your skin. So the cause in this case could be probably 2 things. Coming off the thorn would be a whole lot of bacteria. So there would be microbes. This would cause the start of the inflammation. But there will also be the trauma of all the cells here. So we would get a lot of necrotic tissue. So it's important to note with the causes, like the physical cause, the chemical cause, the ischemic cause, these will cause tissue death or necrosis. And it's the necrosis or the dead cells, like here, that would start the process off. So let's just say we have dead cells with bacteria. Now, sitting within the under the skin, we would have a whole lot of resident cells. So we might have mast cells, we might have some macrophages. Up here we might have some dendritic cells. Okay, so there's a whole lot of cells that are sitting around which are part of the immune system waiting for something to happen, plus all the cells that have been injured. Now, what happens with these cells, the mast cell is a good one. It releases a chemical which we call histamine. Macrophages is another good one. So these are big cell eaters. They would release something called prostaglandin. And then there's other cells in here which might just release cytokines. So the first part of the inflammatory process to be aware of is you need to have some kind of cause, some kind of injurious agent, and then we need to produce pro-inflammatory chemical mediators. In this case, histamine, prostaglandin, and cytokines. Now these chemicals will go to the blood vessels. So this is the first phase. This is the vascular phase. What the blood vessel will do predominantly with histamines, so histamines will go here, the blood vessel will dilate. So the walls or the sphincter will get bigger. That will cause more blood flow to the region. So vasodilation is the first step. This is caused by the chemical mediators, particularly the histamines. So blood vessels dilate, get bigger, more blood comes to the region. So this, as you'd imagine, if you bring in more blood flow to the area, that's going to be your first two localized clinical signs, being redness and heat. More blood, it's going to go red. More blood, it's going to bring temperature, hot. Okay, so that's the first step. As it brings more blood, okay, there's going to be more flow, which is good because it's going to bring white blood cells to help with the removing all this problem. Okay, the next step that happens with these chemical mediators, what they're going to do is also go to these cells here that line your blood vessel. These are called endothelial cells. Okay, now they are usually stuck together, holding hands. Okay, but with the chemicals, the cytokines, the histamines, that will cause them to retract. So these cells will actually get smaller. Okay, so as they get smaller, what that will do, okay, is start to put holes in the blood vessels. Well, it's not really holes, but just gaps. And so what that would do, it would cause more fluid to go out. Now, the fluid that comes out is plasma. So that's the watery portion of your blood, but it also will have cells in it, and it will also have plasma proteins in it. So as that goes in, that's going to cause a process called exudate. Exudate is a term that means plasma fluid and proteins and cells, opposed to transudate, which just means plasma. So this has got things in it. So plasma proteins, which is important, like complement proteins, which would hopefully try to kill off that bacteria, but also kinins, which also helps with the resolution of that injury. So fluid's going to rush out. As this process of endothelial retraction is what we call vascular permeability. So it's an increased vascular permeability. This is the second part of the vascular phase. So the first part was vasodilation, increase in blood vessel diameter, more blood flow comes to the area. The second phase of the vascular phase is endothelial retraction, which means the cells get smaller, and that means more fluid leaves, and we get exudate. As you'd imagine, as you get exudate, you get swelling. So the tissue swells up. This is the third localized sign, being swelling. So the exudate is now activated or now occurring. Now, with some of the plasma proteins, they're going to be activated like the kinins. So the kinins, particularly bradykinin is a good one. Okay, and what that's important for is sensitizing your nerves. So let's just say in your skin here you have nerves. Okay, now with the combination of bradykinin, also prostaglandin, And also all that swelling is going to cause these nerves to be ultra sensitive, very, very sensitive. And as the sensitization of these nerves increase from a combination of bradykinin, prostaglandins, and just pushing on it from all that swelling, it's going to go back to your brain and say, this is painful. So this is the fourth sign of inflammation, being pain. Probably the combination of the exudate and the pain is going to lead to the fifth sign, being the loss of function. So there you go. That's the 5 localized signs of inflammation there. Now we move into the third phase, which is the cellular phase. So as this vascular phase is happening and we're losing all the fluid out into the tissue, what happens to the composition of the blood in here is it actually becomes more viscous, thicker, because you've lost all the fluid. Now what happens is all the red blood cells accumulate in the middle because they're smaller. So there's a column of blood flow in the middle being all your red blood cells. Okay? Now the bigger white blood cells come off to the side. So like the big neutrophils come to the side. Now neutrophils are the most abundant white blood cell, and they're the most important white blood cell for acute inflammation. So they're getting pushed off to the periphery because the blood flow is slow now. All the red blood cells sit in the middle, and the white blood cells, in this case the neutrophil, sits off at the side. So this is what we call margination. So they get pushed off to the endothelial cells, and they slowly roll down the outside of the blood vessel. Now with the cytokines, histamines, etc., they're going to the endothelial cells, which will make them more adherent, and that means the neutrophils get stuck on them, and then they'll actually start popping out. So the neutrophils will actually squeeze through and start coming out into the tissue. Now, they will follow through a chemical gradient called chemotaxis. They will follow where the injury is. This could be a combination of chemicals from the dead cells, antigens from the bacteria, or the chemicals released from these cells like the macrophages, the mast cells, the dendritic cells, like cytokines. So they're actually going to follow it and go to that area. Neutrophils are important because they are going to start eating up all the damaged cells and all the bacteria. So they become actually phagocytic. So they start chewing up and eating up. Now neutrophils, neutrophils are very short lasting, so they will generally come on the scene between 24 to 48 hours. That's their peak time on inflammation, whereas later on macrophages will come after 48 hours, or that's when they will peak. Macrophages will come from monocytes. Monocytes are white blood cells. This process takes longer, whereas neutrophils, the upregulation within the white blood cells or the creation of new white blood cells in the bone marrow happens very quickly. Macrophages takes longer, and that's why it peaks at a later date. So the neutrophils come in, they go through, they go to the area, they start eating up dead tissue and bacteria, and this is probably where you're going to get a lot of the pus come in, because there's a whole lot of dead cells and bacteria and so forth. Now, at the same time, we've got all those cytokines such as, I'll pull out here, interleukin 1, TNF alpha, so that would be tumor necrosis factor alpha. These are released by these cells, and these cytokines go into the blood, and that will then go systemically. So these TNF alpha and interleukin 1 actually then goes in the blood and goes everywhere. So these ones here are now examples of what's causing systemic effects. So these chemicals will go up to the brain and cause your hypothalamus to change its set point. So it's, instead of setting at 37 degrees Celsius, it's going to go up to 39 degrees. And that's going to cause you to have a fever. So that's a systemic response. It's also going to go to your bone marrow and tell you to make more white blood cells. So this is the leukocytosis. Also remember that your white blood cells work better at a hotter temperature. So when this fever goes up, your white blood cells are probably going to do a better job and a more efficient job as the temperature is higher. These cytokines also go to your liver and produce more plasma proteins like the complement proteins, like the kinins. Okay, it's also going to go to your brain and tell you that you're starting to feel a bit maybe nauseous, but also anorexic, so you're not wanting to eat, feeling lethargic. Now, as a result of the fever, your body needs to bump up its metabolic rate, so your heart rate will go up, your breathing will go up, your blood pressure will go up. And this is the reaction, the systemic reaction to the inflammation. So, what you see now is the process itself has two main phases, the vascular phase, the cellular phase. The cellular phase is a combination of the cells that started the release off, but then these white cells take over to hopefully remove the agent and neutralize with the exudate and hopefully cause whatever caused the problem to be removed away. So this leads to the outcome. The outcome of acute inflammation is three. There's either a complete resolution, which means the agent gets taken away, this gets neutralized and removed, and the skin gets closed up. Another thing that I forgot to mention is also these chemicals are good and important for activating fibroblasts. So these are connective tissue cells which will come into the area and start to repair it. So that will, if you remove this thorn, the fibroblasts will start to lay down collagen and hopefully seal that off, and then you repair. So that would be resolution. If you remove the agent and it gets completed, then you'll have complete resolution. Now, if it wasn't perfect, if particularly you cause damage to parts of the body that can't repair itself, like the heart, so if that wasn't the skin, but that was your heart and you had a heart attack, muscles of your heart can't replace themselves. So what happens is the fibroblasts lay down over where the muscle cells died, and you replace muscles with collagen, which means that now you have a fibrotic reaction or a fibrosis. Now that could be okay if it's a small degree of injury, but if it's a big part of your heart that's died, you're going to lose a lot of muscle and then have connective tissue, which would result in a negative outcome, and maybe the patient will die or have a degree of heart failure because it can't pump effectively anymore. That could be also a problem in the lungs if you have things like pneumonia, or in the liver if you were to have inflammation and you then had scar tissue, and that would lead to something like cirrhosis. Finally, the third outcome that could take place would be chronic inflammation. So if you don't remove the agent, or if it's a really serious infection like a viral infection, or if you have an ongoing immune response like an autoimmune disease, you will have chronic inflammation. So this is an ongoing inflammatory process. There are different cells that are involved in chronic inflammation, such as monocytes and lymphocytes, but this is a long-standing inflammation, unlike this one, which is acute, and it will disappear after a few days. So there you have it. That's acute inflammation. Hopefully it all made sense. So hopefully now you know what is inflammation, what's the purpose of inflammation, what's the cause of inflammation. You know the clinical features, and you know what causes the clinical features. You know the process, the two main steps, vascular and cellular, and then you know the three possible outcomes being resolution, replacement, or chronic inflammation.